Gentlemen, let me ask you something. Have you noticed yourself rushing to the bathroom more often, dribbling after you pee, or struggling with a weaker stream? Or maybe your erections aren't as firm, morning wood seems to disappear, or your stamina just isn't what it used to be. If that sounds familiar, here's the thing. You don't have to accept this as the way things will be forever. I'm Dr. Nerita, a urologist with 12 years of experience in men's health, and today I'm going to share a simple $2 technique you can do at home that can support your prostate, urinary control, and erections. Before we jump in, do me a favor. Like this video, comment where you're watching from, and subscribe. That way, you'll never miss practical, research-backed tips to keep your body performing at its peak. First, let's clear something up. The prostate may be small, but it's hugely important. It sits just below your bladder, wrapping around the urethra, the tube that carries both urine and semen. Essentially, it's right at the crossroads of your urinary and sexual systems, which is why problems here can affect both. Your prostate doesn't just influence urination. It also plays a key role in sexual function. It produces about 30% of the fluid in your semen, which nourishes and protects sperm. And during orgasm, the prostate contracts to push this fluid out. So when it's inflamed, enlarged, or weakened, it can affect your urine flow, the strength and frequency of erections, the force and volume of ejaculation. Here's what typically happens as men age. The prostate often grows, a condition called BPH, or benign prostatic hyperplasia. Think of it like this. The prostate wraps around your urethra like a rubber band around a drinking straw. At first, everything is loose, no problem. But over time, as the rubber band tightens, it squeezes the straw, slowing urine flow and causing urgency. And it doesn't stop there. That same pressure can compress nerves and blood vessels needed for erections. The prostate is essentially a control center, sending signals that help your penis respond. When it's inflamed or enlarged, these signals can get blocked or distorted, which may explain weaker erections or loss of morning wood. So here's the good news. There's a safe, simple, evidence-based way to support your prostate, reduce pressure, and even improve sexual performance. Here's where most men go wrong. 1, waiting too long. Many men think, I only wake up once at night. It's not a big deal. But prostate changes progress gradually. By the time symptoms are severe, like multiple night trips or urinary retention, the options become more limited. 2, ignoring simple solutions. Most men don't know about external prostate massage. Safe, non-invasive, and effective, it's rarely discussed because it's uncomfortable for many. 3, neglecting pelvic floor strength. Weak pelvic floor muscles contribute to urinary and sexual problems. Even minor neglect over time can amplify symptoms. 4, over-reliance on medication or devices. While pills or invasive procedures may seem like quick fixes, they often come with side effects, risks, and high costs. Simple, consistent habits often provide better long-term benefits. Here's the solution: external prostate massage using a tennis ball. Yes, you heard that right. All you need is a tennis ball and a firm chair. Step 1, place the tennis ball in the center of the chair. Step 2, sit down slowly so the ball presses against the area halfway between your testicles and anus, known as the perineum or taint. Step 3, gently roll forward and back, just an inch at a time. Step 4, breathe slowly, relax your pelvic floor, and let the pressure stimulate circulation. Think of it as physical therapy for your pelvic muscles. Just 5 minutes a day, 3 to 4 times a week, and you may start noticing reduced urinary urgency, better bladder emptying, firmer, more reliable erections. Why does it work? Biologically, stimulates nerves, blood flow, and pelvic muscles. Emotionally, restores confidence and independence. Practically, quick, discreet, and controlled. No undressing, no devices. Some men wonder about internal prostate massagers. Yes, they exist and can target the gland more directly. But for most men, especially beginners, the tennis ball technique is the safest, easiest, and most effective starting point. 5 minutes, no special gear, no medication, completely under your control. In addition to massage, supplements can help. 1, nitric oxide boosters support blood flow and erection quality. 2, natural testosterone support, maintain energy, libido, and hormone balance. 3, prostate health blends reduce inflammation and support normal growth. 4, oxidative stress support, protect nerves and tissues, reduce performance anxiety. These are clinically backed, safe, and not gimmicks. Links and detailed science summaries are in the description and pinned comments. Gentlemen, this is important. More than half of men over 50 have some form of prostate issue. Weak erections, BPH, or early-stage urinary problems are common, not shameful. Talking about them and taking action is a sign of strength, not weakness. By supporting your prostate, you're protecting your confidence, independence, and intimate life. Small, consistent steps, like the tennis ball massage, can prevent problems from worsening and improve day-to-day quality of life. Here's my challenge. Start the $2 prostate massage today. Just 5 minutes, 3 times a week, and see how your body responds. Combine it with the supplements I mentioned for maximum support. If this video helped you, share it with a friend or partner. You never know who might benefit from a small, simple change. For more science-backed men's health advice, hit subscribe and turn on notifications. We cover everything from performance, hormones, to confidence, without fluff or embarrassment. Remember, age is not the end of vitality. Small, consistent actions, supporting circulation, strengthening pelvic muscles, protecting your prostate, can bring freedom, confidence, and comfort back into your life.